Here at the MedStar Orthopedic Institute at MedStar Health, we have a breadth of services for people that need joint replacements. So obviously we all know about total hip, total knee replacement. We also have total shoulder replacement, total elbow replacement, and total ankle replacement. Amazingly, all of those joint replacements can be done safely and effectively for many patients in an outpatient setting.
In orthopedics, there is this shift from traditionally inpatient surgeries to outpatient. At MedStar, the majority of those are hip and knee replacements, but we also have shoulder arthroplasty cases, foot and ankle replacements, and then spine surgery has a subset of patients that are benefiting from going home the same day.
When I first started in practice, patients would stay 7-10 days after surgery, to the point now where we've gone from 7 to 10 to 4 to 5 to 2 to 3, and now most of our patients are going home the same day.
I've had not one but 2 knee replacements at MedStar Health. I had the first surgery done on my right knee, spent the night in the hospital, and they took very good care of me. But when it was time for me to go home, I was ready. I was ready to make that decision and go home and start the healing process. My surgery on my left knee was different than the right knee. I was able to go home the same day, and that was through the discussions with Dr. David Gold.
When we first started promoting outpatient surgery, there was a lot of surprised patients and family members. You know, they're used to the old way of doing this with several nights in the hospital. What's interesting is as we started this and patients started to hear about it, there were many patients who said, I want to go home and I'm interested in this. So it wasn't a difficult conversation. They just wanted to know what to be aware of and what to be concerned about.
With the advances we've made at the time of surgery, specifically in pain management control and anesthesia around a surgery, we've developed these rapid recovery protocols that allow patients to get up and moving quickly after surgery.
The benefits of going home the same day are that it is certainly always better to recover at home. Hospitals in general, and our hospital is a great place for healing, but they're also a place for sick patients. Our total joint patients are not sick patients. They're well people that have a bad knee or a bad hip or a bad shoulder. So they don't need to be in an environment with other sick patients.
In select patients, they are just as safe going home the same day of surgery as they are staying in the hospital. Numerous research studies and literature in the past have really shown this to be true, and it's also been our experience at MedStar that patients do just as well and are just as safe going home the same day of surgery.
It's a huge step forward because patients can go home to their home environments. They have control over their pain medication, their regular medications, and they're more motivated to get up, walk around, and start taking care of themselves right away. In fact, I saw this with my own mother, who had a hip replacement done as an outpatient very recently. We brought her home, she was up walking right away, she was eating better, and she just really recovered fantastically. MedStar Health and the MedStar Orthopedic Institute have really made huge steps forward in how we take care of patients orthopedically, in general, and especially for outpatient joint replacements. We have an entire team that's gotten together to figure out the best way for us to get patients from before surgery, through the day of surgery, and to home, and how we take care of them afterwards.
We are a team of specially trained healthcare professionals who follow patients through their entire continuum of care. So when they're posted for surgery, we work with them to make sure they have a smooth process leading up to surgery, and we help them with their recovery and their rehabilitation. Each patient is paired up with a patient care coordinator who reaches out to them a few weeks prior to surgery to help them get involved with any education they may need leading up to the surgery. Discussing their discharge plan, who their support's going to be. We kind of have all of that set up before they even come in for their surgery. Scheduling preoperatively any rehab appointments, needs that they'll have post-operatively, and helping them understand what to expect before, during, and after surgery.
And just because you're going home the same day doesn't mean that you are losing the connection to us. We have people that are a phone call away at all times, day or night, to provide answers, to provide help. We know that telehealth works. People can use video to help us see something if they have a question. And we are much more connected, as we all are today.
This is really a collaborative effort for the benefit of the patient to make sure they have a successful discharge and a successful recovery.
At MedStar Union Memorial Hospital, the therapy area is located just a few steps away from the operating rooms, which was a very intentional decision because this makes it an easy and smooth transition for our patients. They don't have to change floors, they don't have to go very far from one area to the next. It also allows for easy communication with our staff between the nurses, the therapists, and the orthopedic team. After the patient has their total joint replacement, physical therapy will first go and see the patient at the bedside, and we'll do an assessment and teach the patient how to safely move around, how to get in and out of bed, how to stand, how to walk using a walker. We'll teach them how to get in and out of a car, how to manage their home exercise program. We'll teach them how to get up and down stairs safely if they have to do stairs when they leave. And then we'll teach them about any precautions or restrictions that they have after surgery to make sure that they'll know what not to do. I believe MedStar Health is the best place for an orthopedic patient to come for their surgery because we have the best team. We work together from the time you meet your surgeon in their office, through your surgery day, through the therapy, through your recovery. We're there every step of the way to make sure that you are safe and comfortable, and we're remembering to keep you as the most important part of our team.
Once I was in recovery room, physical therapy came in and was with me for quite some time and was able to walk me through some steps. Was able to bend my leg a little bit, take a few steps, come down a few steps, with assistance of course. But that made the difference in me going home that day. When I look back at the two experiences that I had, it was much more comforting for me to go home because I felt a lot more comfortable being home and to help the healing process start a lot sooner. Today I have no pain in my knees, and I'm very thankful for what MedStar was able to do to give me back my quality of life.
We get to see and hear a lot of the success stories and the great outcomes that our patients have, and it makes me very proud to work for a team that works so hard for our patients.
In addition to all of that, we make sure that we are really at the forefront of technology at MedStar. We have an entire clinical value analysis team that works with supply chain to make sure that we have the cutting edge instruments, cutting edge implants that are really going to help our patients get better faster and better. And we meet and discuss all of these things. And if necessary, we have an entire clinical team which works with doing clinical trials to make sure that we're doing everything in the safest, most effective, and most cutting edge kind of way that we can for our patients.
At MedStar Health, we're committed to the best quality of care, best patient experience, most innovative technologies. So absolutely, you should come to MedStar Health for your orthopedic care.